Suffering from pain keeps many people from enjoying their everyday activities, but there's one place in the Tampa Bay area that may be able to make a real difference in your life. Dr. Rudy Gary is back today with how the Florida Pain Relief Group can help you. Good morning. Welcome back.
Thank you.
This morning we're talking about regenerative medicine, which I just told you earlier. I love talking about this subject because from what I understand, from what I'm learning from you and your team, this is really kind of where the future is in medicine, and it's growing rapidly. We're learning more, correct?
That's correct. This is the most exciting part of medicine. And regenerative medicine is, as the name says, it allows our own bodies to regenerate injury. So if you have an injured tendon, an injury to your joint, there's medications, typically known as stem cells, that we can inject into those areas, and it allows our bodies to just fix that by itself without having to get other interventions like surgeries or implants.
So, and we've talked different thing about joint pain or muscle pain, or is regenerative medicine helping all of those aspects? What are we seeing the most success in right now?
We are using regenerative medicine just about anywhere. If in shoulders, joints, in your lower back, any place that has an injury, we can go in there and usually put some medications, and there's different types. So sometimes there's like something that's called stem cell recruiting factors that we can inject. It's a little powder that helps your own body stem cells go right to that area to really help heal it. Or we can inject actual stem cells that will take the form of the tissue that's been injured and regenerate its own body part there.
How often are you doing this in your office? Is this more often than what you're doing other things? In comparison to...
We're doing this a lot. We're doing this a lot, even in athletes. We have professional athletes that come to us, and they come to us because they don't want to take anything exogenous, and they want to be able to have their bodies heal itself.
Well, that's what I was wondering, as for a doctor, how do you decide when, okay, regenerative medicine is going to be the best avenue, of course of action of what we're going to take to treat somebody's pain?
Well, what's exciting is the more natural that we can make the treatment, the better. So what more natural is there than your own body healing itself?
Yeah.
And that's really what regenerative medicine is all about.
Where do you see the future of this headed? Where do you think, 5, 10 years?
Well, I'll tell you, I was actually reading an article in Scientific American years ago. And believe it or not, the theoretical age of human beings to be able to live, it's almost like 800 years old. Theoretical, because if we can regenerate organs, regenerate tissues, cure cancers, and a lot of those things, there is really no limit, and the medicine is so exciting.
I would imagine so. I can tell how excited you are about this. Well, if someone's watching this morning and says, you know what, I want to find out more, I'm dealing with pain, could this be my solution, what would you have them do? Well,
to tell them is first, see your doctor. If you have a primary care doctor, your primary care doctor can refer you to us. If you don't have one, or if you don't want to for whatever reason, you can see us directly.
Okay.
And if you need authorizations, whatever you might need, we can get in touch with your primary care, or a lot of insurance plans just allow you to come see us. We'll be happy to see you and find out what is wrong with you and come up with a plan to help you get better.
Yep, and I know talking with you over the last few months, I can tell how excited you are when you literally are able to help change people's lives and to help them feel better. So thank you so much, Doctor, for being here this morning. We look forward to having you back. And again, there is their number to call and their website to find out more information as well.